full impact on the new variant. You've just seen Moderna, one of the big US pharmaceutical companies, say that their vaccine will be fully effective, but there is still some testing that needs to be done for that answer to be 100% correct. Could this new variant overwhelm the healthcare systems of our country and healthcare systems around the world? Because this is still early days. It was in early December that these variants were detected. So these are still early days, and that's a big concern. Here is now what experts believe India needs to do. Massively scale up surveillance for corona variants. The surveillance in India is still quite low. It needs to be much higher. If the UK had not detected it, perhaps we would never even have known about it. India needs to be proactive. Now that it's been detected, this variant's been detected in the UK, now India has reacted and is, being more cautious and has scaled up surveillance. India has suspended all flights to and from the United Kingdom, but travel bans with suppression of local transmission. It takes just one case, unprotected, unhindered, to actually create an outbreak in the country. And here finally, because this is not just about countries and governments, this is also about us. This is about you and me, viewer. And this particular variant, most experts believe it's probably already here in this country. We need to reset our risk assessment and reduce social contact. We need to, because remember, it's been 10 months in the pandemic. Most people have become complacent. They're attending social functions, they're attending weddings, they're attending small get-togethers and parties, even occasional outings. This is a big reminder. Weddings and vacations become even more risky now that there is another variant of the coronavirus out there that we do not fully understand the impact of. Totally avoid. This is advice from experts, and you're going to be meeting that expert right here on 5 Live in just a moment. Totally avoid the 3 C's right now. Crowded places, close contact, and confined spaces. That is very important. People are yearning for a little bit of normalcy, but the smallest bit of complacency, letting your guard down even a little bit at a time when there are new variants out there which could easily spread, and we already know their transmissibility is significantly higher than the baseline coronavirus, means that the threat is very real. Joining me live is Dr. Swapnil Pareikh. He's a very well-known physician based in Mumbai. He's been studying the impact of coronavirus very closely. He's also the author of a book called The Coronavirus, which I would strongly suggest you read. Welcome, Swapnil. Swapnil's also written a terrific piece for India Today. You will find it on our website. And all of the information that we just put out on our screen just now were basically distilled from Dr. Parikh's piece. Swapnil, the fact is right now, I want to focus just a little bit on the advice that you've given to individuals in your piece. Avoiding the 3 C's, the complacency that's already set in. There's a great deal of corona fatigue in populations around the world, certainly here in India. If you go out now, chances are you will see crowds of people not wearing masks. How much of a risk is this going to be with these 2 new variants out there, Swapnil, that we don't really know very much about?
Hi, Shiv. Thank you so much for having me on your show. Not just the 2 variants that we know about, all the other ones that we don't know about, all the variants that may emerge in the future. And indeed, the original coronavirus, SARS-CoV-2 that we started with, these are all diseases, they all called diseases of people. When people come together in closed settings, in poorly ventilated areas, don't use masks, the virus spreads. It just needs a few minutes to change your life forever. And we can't get fatigued because the virus doesn't sleep. It doesn't stop. When it gets an opportunity to spread, it spreads. It jumps from one host to the next. And in a sense, that actually shows us that we do have the power to stay safe, because this is a respiratory pathogen. It's a variant of the same virus we have been dealing with, that we have been fighting with. And all the interventions that were effective against the other variants are effective against this variant. The only thing is, because it's more transmissible, we have to be far more disciplined about following those precautionary measures. Everything that you said, masking,
yes,
distancing, avoiding crowded places, close confined spaces with poor ventilation, hand hygiene, all of that.
Swapnil, Speaking about the healthcare systems that could get overwhelmed, the very interesting thing that you have here in your piece is that it's, it's not just these new variants that will overwhelm. It's not going to take just deaths to overwhelm the healthcare system. The smallest bit of complacency right now, could actually mean that all the hard work of the last 10 months to reach something of an equilibrium as far as hospitals, the availability of ICU beds, etc., all of that could be very severely damaged if people are irresponsible. Is that right?
Absolutely, Shiv. You mentioned everyone wants to get back to some sense of normalcy, and everyone is feeling fatigued. But just think about all my brothers and sisters in the medical fraternity right now, what they're going through, how fatigued they have been feeling, how much at risk they have been through, doctors, nurses, people who clean hospitals, all the frontline workers who have been fighting non-stop. For them, the idea of another surge, of a more transmissible virus, it's extremely difficult to convey what
Yes.
the kind of impact it has on us, our psyche, our ability to continue fighting. So please do everything. Everybody should do everything they can to lower the risk of transmission of all SARS-CoV-2 variants. The fatigue is real. I do understand how people feel about this, but the key takeaway is that all the interventions that worked against the past variants work against this variants, and we all have a duty to do this right now.
Yes.
We can build new ICU beds. We can probably add some hospital capacity, but we can't train enough doctors and nurses in time. And if you have imagine a hospital where you have 1,000 beds, and if you have 800 COVID-19 patients, you can treat them all. But even if you have 1,500 patients, but it's not a more lethal virus, it's the same virus. But if you have more cases, 500 patients aren't going to get treatment, and they're going to have poorer outcomes. So that's the real concern, that if it's a more transmissible variant,
Yes.
it's going to overwhelm our capacity to provide care to those who need it. And I think it's going to cause a collapse in the healthcare system in general.
Swapnil, people across the country, who've been through this pandemic, who know people who've had COVID-19, who've taken precautions, like I said, the fatigue factor has set in. Most people have started taking precautions and doing certain things, meeting small groups of people, inviting neighbors over. The small things where we let our guard down, I think most people have started doing them. And since nothing disastrous happens, they continue to do that. Are you saying that with these new variants, but also with the existing threat, all of that needs to be reassessed and reset? People need to stop doing even those things that they've started doing in a calibrated manner?
Shiv, so there's this, we convince ourselves that things that have kept us safe in the past are going to keep us safe in the future. Just because you got lucky 9 times in the past doesn't mean you'll also be lucky the 10th time.
So true, yeah.
So everyone should be doing everything possible to reduce their social contact. There are some people who do not have the privilege to reduce their social contact. Those of us who can reduce our social contact have to do it for our own safety, but also because we have a duty to lower transmission. And you're absolutely correct. With a more transmissible variant, things that might have been safe in the past, maybe going out once a week, that might have been safe for you. With a new, more transmissible variant, I think we need to reset all our rules. We need to assess the risk again very carefully.
One final question, Swapnil, is on the vaccine. And, this has been discussed quite a bit over the last few days. And Swapnil's piece on our website goes into a very well-explained detail on what we know and, very importantly, what we don't know and what the days ahead might actually, give us in terms of the efficacy of vaccines. We've had companies like Moderna, Swapnil, come out today to say that their vaccine, they expect it to be completely effective against these new variants, but they will need to do more testing. So that I'm assuming that's going to be the order of the day, that there is optimism that the vaccines will work against these new variants and future variants, but there is going to have to be a lot more testing on that front, Swapnil.
Right. So to put it very simply, on the cover of my book, if you look at this little blue part, it's the spike protein. And the spike protein has multiple different areas that our immune system can recognize. So if one part of that spike protein changes, the immune system can still recognize all the other parts. And people should feel reassured that the existing vaccines incorporate the entire spike protein. So we should have, some protection when we're vaccinated. We don't know right now even whether there will be some loss in efficacy. There will
Yes.
be. The important thing is that there will be future variants. And as more and more people get vaccinated, it's possible that variants will emerge that can beat some of the vaccines, and the vaccines need to be updated. But again, the good news is that if we keep transmission down, not only do we mitigate against all variants, but we also reduce the risk of future variants emerging. Really importantly and really quickly, Shiv, we talk about the efficacy of
Yes,
vaccines.
yes.
But what we need to remember is that if we have a sudden surge in cases, and we have a large number of cases that occur now, the effectiveness overall of the vaccines in reducing the peak of the pandemic, because that's what we're looking at from a public health perspective. We want to reduce the peak of the pandemic. If the virus starts spreading more right now, and even if the vaccine is as efficacious, its effect on the peak of the pandemic will reduce. So that's the takeaway. We need to do everything to reduce transmission right now.
Are you optimistic, Swapnil, that there won't be any big consequences of these new strains in India? Most experts believe it's quite likely that the strain is already here. It's just a matter of detecting it. But do you see any big flare-ups? India has gotten things sort of under control. The numbers are low. The recovery rate is pretty good. Do you foresee any, big flare-ups as a result of these two new variants or upcoming variants?
Shiv, most experts are concerned about this variant. Its name is a variant of concern.
Yeah.
And with outbreaks in general, you have to respond really quickly. You can't wait till you have conclusive evidence that it's spreading widely or that it's having a huge impact. You have to move fast, you have to move early, and you have to move aggressively. So, irrespective of whether we think this is going to be very severe or not, we have to attack it aggressively, and we have to act early. It's better to overreact than underreact. But yes, personally, I am concerned that this is going to have a negative impact on India's pandemic situation.
Swapnil Pareikh, it's been a pleasure. Thank you so much for joining us and, answering those questions. I know many of these questions have, are open-ended because we're still figuring things out as we go along as far as this is concerned. But once again, a reminder to all of our viewers, go on to indiatoday.in. You'll find Dr. Swapnil Pareikh's piece for us today. It's a great, very succinct explanation of what these two new variants mean and what you can actually do about it. So thank you, Dr. Parikh, for joining me here.